Good evening, all of you. Once again, welcome back to the 80th National Conference of the Associations of Surgeons of India. As I've mentioned earlier, the official inauguration of ASICON 2020 is over. So now we are having Dr. N. Balakrishna Rao Oration. For that, I would like to welcome Dr. Achal Gupta from Gwalior, Dr. Prabal Niyogi from Allahabad, Dr. Deepak Chawla from Jalandhar, Dr. Jugal Kishore Chowdhury from Deoghar, Dr. Banwan Lal Yadav from Jaipur, and Dr. Shiv K. Misra from Kanpur. First and foremost, I would like to welcome Dr. Achal Gupta from Gwalior to orate Dr. N. Balakrishna Rao. Sir, you may please take the dais. Welcome Dr. Achal Gupta from Gwalior to orate Dr. N. Balakrishna Rao. I welcome Dr. Deepak Chawla from Jalandhar to orate Dr. N. Balakrishna Rao. Welcome, Doctor. I request Dr. Deepak Chawla from Jalandhar to please unmute to start oration.
It's a pleasure to have Dr. Shiva Mishra with us, and on this occasion, I think we'd like to proceed with the oration, Dr. Balakrishna's oration, and I would request Dr. Shiva Mishra to proceed.
Good evening. Namaskar, chairpersons, ladies and gentlemen. It's a great privilege and honor that I have been asked to deliver an oration in the name of a legendary surgeon of the country, Professor B.N. Balakrishna Rao. Professor Balakrishna Rao has been a phenomenon. He has been past president of the Association of Surgeons of India, and it's a proud privilege to present oration in his name. I welcome all my audience for being here. We heard Sadhguru a while ago, and the topic which I have chosen is about my pleasure as being a surgeon. Why I have chosen this topic, you will come to know as a surgeon how we practice and what pleasure we derive out of this noble profession. So let me share my screen.
Shiva sir?
Yes?
I have to read about Dr. Balakrishna Rao sir.
I think that is very important. So
yeah. So
is bad.
Yeah. So I'll just start with that. Good evening, friends. It's my honor and privilege on behalf of ASI to read a citation about Padma Shri Dr. B.N.B. Balakrishna Rao. Professor Basava Patna Narayanan Balakrishna Rao was born to Mrs. Rukmani and Rao Bahadur, Dr. Narayan Rao, who was a renowned ophthalmologist from Mysore, who established the Minto Ophthalmic Hospital at Bangalore, which is currently the upgraded Regional Ophthalmology Hospital. Dr. Rao belonged to an illustrious Sankheti Brahmin family from Palghat in Kerala, who later migrated to the erstwhile Mysore state. Dr. Rao graduated in 1933 from Bombay with 10 medals and 17 scholarships to his credit. He finished LRCP MRCS from UK in 1936 and was later admitted to the Royal College of Surgeons of England in 1937. On his return from UK, he joined the Mysore State Health Services and later as a teaching faculty at Mysore Medical College, where he was professor and head of surgery from 1945 to 47. And he had special interest in neurosurgery. Dr. B.N. Balakrishna Rao moved to Gwalior as a professor and head of surgery at GR Medical College in 1947 and rose to occupy the chair of the dean in 1964. Later, when All India Institute of Medical Sciences was founded, Dr. Rao was invited to become the head of surgery and emeritus professor, a position which he occupied from 1964 to 1972. He also served AIMS as its superintendent for 2 years from 1970 to 1972. He occupied the chair of emeritus scientist of ICMR from 1972 to 1975. And Dr. Rao was awarded Padam Shri in 1973 and was honorary surgeon to the President of India for many years. Dr. Rao held many key positions in various academic bodies and universities. Dr. Balakrishna Rao is the founder member of the Association of Surgeons of India and was its president in 1960 and 1962. He was conferred the honorary membership of the International College of Surgeons in 1993, the highest honor of the organization. Dr. Rao was every inch a surgeon full of knowledge, quick in decisions, and with a masterly operating craftsmanship, and above all, an able administrator. An ardent fan of cricket, he passed away silently on 7th March 1995 while watching a game of cricket. To commemorate his contributions to the art and science of surgery, a galaxy of his eminent students started an endowment in 2000 and the oration. So I invite Dr. Mishra for you for your kind oration, please, sir. Thank you very much. Thank you.
So, ladies and gentlemen, once again, I welcome you all, and I bow my head in the memory of the great surgeon, Professor V.N. Balakrishna Rao, in whose memory this oration was instituted. And I bring greetings from the Central Council of Health and Family Welfare, as well as from National Board of Examination, which I represent as Vice President. So, coming to just my talk, which is on pleasures of being a surgeon. And this is my 4 decades of learning in surgery, which I am sharing with you colleagues. Now, this is how I became surgeon and what milestones or what pleasures I have been achieving through this profession, noble profession. We all know that surgery is the most challenging profession. You are the asset to the community. You are the product of the big investment of money, of course, with time and also a lot of energy. You will remain in high demand in the years ahead. Society needs every one of you. Being a surgeon is always a great glamour. Knife-wielding surgeon feels divine with great magical power. This lacks in all other specialties. But as a surgeon, I also wear bodily fluids that are not mine. I work weekends and holidays. I get screamed at and have my hands in other people's orifices. How hard have worked to come to this accomplishment? What price have you paid for the privilege of becoming a surgeon? We see a lot of glamour about surgeon's life in movies, in TV shows. But in reality, a surgeon's life is mixed and there is a lot more to it. While it is true that they do save lives, they also handle difficult realities. Unpredictable days, piles of paperwork, burnouts, and potential harm are some of the challenges that we face while doing our job as a surgeon. I did not come from a family of doctors. My mother was primary literate and my father was a renowned advocate. As early as elementary school, my parents and my only sister, out of 8 siblings, wanted me to become doctor, and I gleefully chose biology as I had no likings for mathematics. I somehow knew very early on that medicine was the career for me. I found glamour in white safari-clad practicing family physicians who practiced in the vicinity with the stethoscope around their neck. Medicine for me has always been a calling as well as a privilege. Being a doctor was for me the ultimate opportunity to help others. As a surgeon, I can have an immediate positive impact on the care of the patients with peritonitis, obstruction, bleeding, and even cancer. It's a gift to have the opportunity to care for the patients in their most valuable times. Despite the stress, long hours away from home and family, I could never imagine a different career. And this was in 1974 when I got an opportunity and I was admitted to MBBS course in this, my very beautiful alma mater, the GSM Medical College, Kanpur. And I graduated and post-graduated from this very institution. It had a beautiful building and campus, great teachers, huge patient load, and above all, the tremendous camaraderie, not amongst our own batchmates, but with our immediate seniors and juniors. During the ward postings in third year, I was watching the surgery with closed doors when I started going to the operation theaters. I was so excited to see how surgeons, residents, senior surgeons working in a vibrant and happening environment. Unlike other branches of the medicine, I decided to become a surgeon. I personally felt that nothing is more beautiful than the feeling of saving someone's life. The feeling of seeing a person smile through their tears is priceless. People bow down to their respective God based on their religion, but everyone bows down to a surgeon irrespective of their religion. I remember my PG days with great nostalgia. The excitement in the unit when the abdomen was opened for tumor, when it was not possible to arrive at the diagnosis preoperatively because the only investigation at our hand was X-rays. The clinical examination, now largely relegated to the background, was all important. The entire unit, as well as the postgraduates from the other units, would be waiting to know whose diagnosis was the correct one. Nowadays, thanks to the plethora of investigations available, whether it is CT scan, MRI, or endoscopy, ultrasound, the diagnosis is known in pitiless detail. As a surgeon, I might be thinking nostalgically of those days, but not if I was a patient. There is no doubt that to be a surgeon is a great privilege. If I remember the days of my residency or the PG days, they're not very different from what is happening today. They were very hard, I would say, but there was a lot of joy also. It will sound crazy to any regular person, but surgeons are not irregular people. It is about discipline, commitment, and meticulousness. Essential skills are acquired gradually, step by step, and seniors who asked us, who kept us busy overnight without food, they were not sadists, but they were realists. They prepared us for a grueling battle ahead. And I am most privileged, as Sadhguru was telling an hour ago, that as a surgeon, you have got the privilege that no other profession has got in your life, is that patient, whether he or she will present to you for examination, for exploration, or doing any surgical manipulation, and that is a great privilege. And this was quoted by my very good friend, who is surgeon turned politician, Sambit Patra, during the ethics consensus meet, which I organized as president of the association in 2017. He said, we should not be begging to the politician or anybody. We are so privileged in the society. I had an opportunity once I did my post-graduation to work as surgical registrar in one of the premier institutions that time, the Narendra Mohan Hospital in the NCR, Ghaziabad, Mohan Nagar, in way back in 1983-84, where I had a lot of surgical experience along with the great mentoring, as the consultants were very nice UK trained consultants who not only taught me the nuances of surgery, but also of the lifestyle. I also developed confidence to handle difficult situations. And there were plenty of pleasures, which I just can't share right now in this forum, but there were plenty. In 1984, on the invitation of the Ministry of Health, Iran, I moved to Iran and I worked there in a hospital, which is now a medical university now. The beauty about Iran was that surgeons were treated as superheroes. They were in great demand and they were highly respected. I can tell you, more than any other specialty. And patients loved to be operated. That was, I think, boon or bonus for all of us, where patient presented himself for surgery. Well-equipped operation theaters, and the patients used to be largely well-nourished, good hemoglobin, good build, and they tolerated even mediocre surgery very well with less of the complications. There was good health budget and salary was decent. I have always found working on the human body fascinating, and I knew I would enjoy using my knowledge to help others. And always, I remember that when I joined MOH Iran, an elderly patient came to me in a very serious health crisis. The patient did not speak English, and unfortunately, my ability to speak Persian was non-existent at that time. But I and other doctors, they understood the surgical problem of the patient. Through an interpreter and with the love and help from the patient's family, we were able to guide the patient through much needed surgery. Patient got cured. And after indicating how happy I was for the patient, we had a hug that transmitted the essence of the doctor-patient relationship. No words are needed to explain why I wanted to become a surgeon. My passion to serve was later reinforced when I got opportunity to operate upon number of young injured soldiers and saving their lives, which was among the most humbling yet rewarding experiences in my life. I was able to expand my opportunities to connect with the patients and families during the most vulnerable times. Each time I work closely with young doctors and medical students, I am again reminded of my initial motivation to become a surgeon. Their joy, passion, and desire to serve others still inspires me. It was in the early 90s when I moved to UAE. There was great salary, luxurious life, little work, minimum stress. But where was the professional satisfaction? I think that made me think that it's not the place, it's not the challenge, so that I decided to move back to my country by the end of the 1994, and I came and joined a missionary hospital where I worked more than 2 decades on a meager salary. I established Department of Minimal Access Surgery, purchased best of the equipments from my own pocket, popularized basic to advanced laparoscopic surgery in masses. There was plenty of opportunity to perform charity, whether by doing low-cost surgery or by offering surgical treatment free of cost, which gave me tremendous professional satisfaction, gratitude of thousands of not so well off but needy patients, good money to meet my needs and hobbies. Leadership role also came from my this period of life, that from local to national and international level, I learned the leadership, and which in effect actually helped not only the fraternity, but I also earned many good friends when I traveled not only across the country, but across the globe. It was when I became ASI president as well as Sank Surgical Care Society's president. Carve your name on the hearts, not tombstones. A legacy is etched into the minds of others and the stories they share about you. This quote from Shannon Elder. And it is so good and so real in any surgeon's life. There was unlimited happiness in operating upon such poor and needy patients that it really made and added a lot of joy to my life. Now I own a small hospital which is purely surgical and mainly focused on minimally invasive surgery, daycare, complete women health, reproductive medicine, bariatric and metabolic surgery, and I am serving the masses through my own setup. I enjoy being a surgeon because there are so many qualities which I think any good surgeon possesses. We have got a specialist knowledge, good communication skills, a bright, eager mind, extensive experience of pre and post-op care, ability to adapt to a changing environment, leadership skills to manage not only your own team, but to help to train the surgeons of the future. The ability to inspire confidence in others, emotional resilience, and ability to support your team in some difficult circumstances. What makes an excellent surgeon? How you define an excellent surgeon? An excellent surgeon is supremely confident, flamboyant, dogmatic, and rich. Rich not only in terms of money, but rich in terms of knowledge, rich in terms of empathy, rich in terms of compassion. That is the definition of excellent surgeon. Excellent surgeon is available, affable, and able in that order. The surgeon that other surgeons and their families consult when surgical advice or operation is needed. I think that is a great sign of an excellent surgeon. The first-class judgment is equally important. You should know when one should operate. How to operate? Yes, a good surgeon knows. A better surgeon knows when to operate, but the best surgeon is one who knows when not to operate. There is certain unacceptable behavior also, which will prevent you from becoming an excellent surgeon. Calmness of the mind and bearing is then required. Not rising panic, not blaming your assistants, not shouting at the scrub nurse. It is something that the great physician philosopher Sir William Osler called equanimity. The ability to coolly assess a difficult situation, think how best to correct it, and then proceed. The great surgeon will feel no loss of face in asking for help from other colleagues. Teamwork is very important. In union, there is a strength. And I'm happy and lucky that for last a quarter century, 25 years, I'm having same anesthetist, I'm having same assistant, and I am having same OT technician nurses. So that is what is good about having good team. But not everyone may be so lucky, or in bigger hospitals, you need to have lot of I think, changing team, but there a WHO checklist will come and help you and guide you that before every operation, team members must introduce to each other. They must know what is their job during the operation for the successful outcome of any operation. Need to be able to adapt to the new and learn continuously throughout one's career is very essential. And this is the most important, I would say, the presentation of all, that do unto others as you would have done unto yourself. By allowing this rule at all times in the outpatient clinic, in the operating room, and during post-operative care, all doctors, whatever their specialty, will be on the path to excellence. It is a rule that I always tried to practice during my own career. But was I an excellent surgeon rather than merely competent? That I honestly do not know. It's always for others to judge, not the surgeon themselves. Definitely not for money should you plan a career in medicine. If the grateful smile and the relieved tears of healed patient really would tip up your juices, then go for it. Of course, the glam element is there too, especially in surgery. That is an incidental part too. Students should look beyond the image issues and focus on the reality of being a doctor. The payout of energy, emotion, and time is so high that pure glam seekers drop out after some time. When to be a carer is more important than a career, then you should go for it. So this is, if you're contemplating a lifetime in medicine, make sure that it is not your parental choice, but it is your choice from your inner being. You wish to serve. Too many MBBS seats have been lost to more deserving candidates because of this. If you have a deep and abiding passion in becoming a doctor, only then you should jump into it. Having taken the plunge, do enjoy the ebb and swell of the waters. The grass is not greener on the other side. It is greener where you water it. And it is important. Lot of dedication, lot of resilience, lot of sacrifices needed in the surgical career. There are plenty of privileges of being a surgeon. You get excellent pay, benefits, and which is very important. You need money to support your family, to have a good living standard, and have a good quality of life, and to face various challenges in the life. So that is important, but that should not be the only reason for that. We must remember that surgeons are daily wage earners. They will earn only when they will operate. Most of us think about how to earn more, but we should also focus on how to save it, how to invest it or create wealth, and how to spend it. One should work smarter, not harder. Most important investment are in yourself, especially you should invest on your equipments, in upgrading your knowledge, in workshops, in conferences, in your journal, everything. I think they will give you higher return. And very important is that you must enjoy your life. Very many surgeons, they forget to enjoy life, and I think their lasting value will also be not very much if they themselves are not happy. And take care of your health. The high salaries that provide financial stability, but there is also satisfaction that you are helping others and you are having impact on patients' health and life. So this is very important as far as the surgical job or profession is concerned. There is immense prospect of job growth, and according to data, the employment of surgeons is projected to increase by 15% by 2026. This is far much faster than the average growth for all occupations. These fast-growing job opportunities means that surgeons are and will continue to be in high demand. And it's very stimulating, surgeon's job, because you have to upgrade yourself according to time. So constant research, constant learning. and a surgeon must find a solution to a particular situation on the spot. There is no retake. So that is also very exciting and stimulating. And it will help mental and intellectual stimulation. And as we know in society, there is a lot of respect for the surgeons as it is once you become a surgeon. And then depending upon what you have attained or what you have achieved, it requires many years of serious studies and it is so stimulating. So surgeons hold people's lives in their hands. So there is a lot of prestige involved. And surgeons have revolutionized the patient care. What it used to be a couple of decades back, now surgeons along with the medical experts, big technology companies and universities. So all these things have got a big impact on today's healthcare system. There are various career choices for surgeons to join any super specialty of their choice and to serve accordingly. There are many employment opportunities right from smaller hospitals to big corporate hospitals or serving into medical universities, medical colleges. So there are various kind of according to your passion for the surgery. It's an exciting job. It never gets boring. Every surgery is a race that needs to be executed perfectly. Surgeons have to make life or death decisions in seconds. While this can be extremely stressful at times, it is certainly very thrilling. So surgeons get to tackle fresh health challenges almost daily, as well as different emergencies in the operating room. And I say I am very popular because I am trustworthy, I am motivated, I am serious, I am decisive, and I am hardworking. And also I'm not arrogant, conniving, or manipulative. So if you want to be popular, improve your likability by adding the above qualities. To be the best, you must be able to handle the worst. And last is my 10 commandments for a happy surgeon. Be positive and learn to enjoy today. No loose comments about fellow surgeons. Know your limits. Keep updating your knowledge and skills. Learn where not to operate. Select your patients wisely. Spend more time with the family. Look after your health. Take a good professional indemnity cover. You are not the first or the last surgeon on the earth. You may come or go, surgery will continue, surgeons will be there. So don't think that you are the only surgeon in this world. With these words, I thank ASI, the executive committee, once again for awarding me and bestowing with me with this honor. And I'm very proud, like many of you, a surgeon, proud to be a surgeon. Thank you so much.
I would like to say a couple of words. My elder brother, Dr. Shivakant Mishra. I would like to apologize for coming in late because I was in the inauguration and I thought that this would start after the inauguration. So there was some misunderstanding. But I will take out a page or a sentence from what he has said. Carve your name on the hearts of people. And he has carved his name on hearts of hundreds and thousands of surgeons in this country. He took ASI out from a time where we were in the pits. And it is because of his astute leadership that when he became president of ASI, that we could come out of the mess. Apart from being an excellent surgeon, he is one of the most helpful and lovable of persons that I've ever seen. And he's my elder brother, I'm not saying, for millions and hundreds of surgeons all over not only over the country, but even all over the world. I'll just read out a couple of things about Dr. Mishra. He's a widely traveled surgeon with immense skills and he's active in AMASI, IAGS, IASG, IMA, and many other organizations. He has been president of IMA and he has worked hand in hand with many other medical organizations, including being the president of the International SARC Society, SARC Surgical Care Society. Shivakant Mishra, sir, he started as from the state level, as he said in his lecture, the state level, he rose up from the executive committee to become president of the Uttar Pradesh, one of the largest chapters in the country. And before being elected to represent the state at the governing council of ASI for 2 consecutive terms from 2010 to 2015. He served as the honorary secretary for 3 years from 2013 to 15 and took a lead role in bringing stability, transparency, order and credibility to the ASI. He was elected to the highest office of the president of ASI in 2017, a very well-deserved chair, and he led the organization honestly in one of the most difficult times of ASI. It is a watershed in his time. After his times, academics came into the forefront. He brought about academics. He brought about the people that he thought they were good, and I congratulate him for that. Currently, Dr. Shivakant Mishra is one of the advisors to the Union Health Minister and is the Vice President of the National Board of Examinations. Thank you, Dr. Shivakant Mishra, sir, for being with us this evening. Thank you, sir.
Thank you.
Thank you, Doctor.